My name is Joseph Barrows, MD. I am the Medical Director and Chief Anesthesiologist at Disc Sports & Spine in Newport Beach. As Medical Director of Disc, I oversee the day-to-day operations of the surgical center, preoperatively, intraoperatively, and postoperatively. Just making sure patients are taken care of, looked after, and making sure all the nurses have everything they need to make sure the patient has a successful outcome. As Chief Anesthesiologist at Disc, I am in charge of overseeing all the anesthetic coverage for all the spine surgeries and orthopedic surgeries here. I think one of the biggest fears that patients have having surgery at all is the anesthetic. It's a little nerve-wracking to feel that you're out of control and someone else who you've just met is in control of your life. Before I get to the patient, there's a number of nurses and doctors that get to see the patient and make sure they're candidates for outpatient surgical center. There's always a risk with general anesthesia. That risk is based off of the patient we're working on and their past medical history and the kind of surgery that we're doing. The kind of surgery that we're doing here at Disc, spine surgery, we're not working on blood vessels, we're not working on major organs, we're working on bone essentially. From an anesthetic point, it's a low risk. And the patients that we have at Disc are candidates of outpatient surgical center, meaning that if they were high-risk patients with severe cardiac or respiratory disease, they probably wouldn't be chosen to have surgery in an outpatient surgical center. The fact that you end up in our presence in the morning of surgery means that we're all very confident that you're going to do quite well. So we have them see a general practitioner or internal medicine doctor to clear them. And if there's any issues, they're brought to me days or weeks before the actual procedure to see if we can improve those issues or decide if they should go forward with their surgery. The morning of surgery is when I'll meet the patient for the first time. I'll already have their chart, their labs, every result that they have, and whether there's any issues that need to be addressed. And I just try to humanize the whole process. They're already uptight and nervous about it, so I need to bring them back down to earth and make them feel a little bit more comfortable. Patients are always worried about they're going to wake up during surgery and feel something. It's never happened under my watch, and it never will. I'm in charge of the patient's entire physiologic process, from breathing to heart rate, blood pressure, CO2, continuously monitoring the patient, making sure they're comfortable, making sure their pain is controlled, and making sure they're asleep and there's no recall. I basically adjust my anesthetic according to their vital signs. The patient needs to go to sleep, put them on a beach somewhere, and when we're done, we bring them right back and they know nothing in between. That's my job. My relationship with the surgeons intraoperatively is like a dance. I know their every move, I know exactly what they're going to do, and I know what they need. After working with Dr. Bray for 7 years, I have an idea of exactly what he wants, and I think he appreciates that, and he can focus on what he's doing and not the other small things going around in the operating room. It's great to have patients that are younger and athletic because I consider myself athletic. I've been surfing for about 25, 27 years, and I think it resonates with them when they meet the anesthesiologist who is surfing and can understand what it takes to them to get back to what they actually truly love.